In April, the CARS committee has decided to separate the current behavioral / decisional capacity worksheet into two different worksheets. The advantage here is it's not going to be hounding the user to answer behavioral health questions on a decisional capacity patient. With decisional capacity, you are going to be required to answer the worksheet based off of these criteria here: against medical advice, release per protocol, and of course the parent and guardian dispositions here. Go over to worksheets, and there's going to be some adjustment here on the right side. This behavioral worksheet, which combined both suicidal and homicidal on one, will be removed. We'll put in the decisional and suicidal separate worksheets up. So you may have to go to all in order to uncover these. But either way, it should turn red should you chose the criteria here below. For the decisional one, we go in and we can see that this information at the top is in a header. It's info already pulled into from your existing report. Scrolling down, you have other choices here that may or may not apply to you. Just hit all NA or no. And then scrolling down, you actually have the decisional assessment. Any EMS care, and of course the patient disposition at the end. Whether suicidal or homicidal ideations are either suspected or confirmed, regardless of your transport disposition, this worksheet will be triggered off of impressions and protocols, specifically the primary or secondary impressions that are chosen with regards to behavioral health emergencies. Once those are chosen, the worksheet on the right icon will turn red, and it will highlight which worksheet should be chosen, which is of course the suicidal and homicidal one. Upon choosing it, go through it, and as the standard format applies, you have a crew member to select. You also have date and time at the top to choose from. On the left side, you have your usual buttons that say OK, cancel, and delete, and of course you can navigate through the different sections by choosing them on the left side. Upon filling out this worksheet, like with all the others, once it's completed, you hit OK. If there's a condition or you want to work inside the form and you need to get out of the worksheet and it's giving you this warning, just go over to the power tool button, any power tool actually, select it, and it'll jump into that power tool. Just cancel, and it'll default back to the main form. If you need to get back to the worksheet again, just go into the timeline, and you'll see the worksheet highlighted here. Scrolling down, choose what you didn't complete, and hit OK. You'll now see the worksheet in the timeline, and of course the red will go away. Using this worksheet will be in lieu of a petition, as the system has abandoned that particular form and has decided to go with the worksheet format with an image trend. As you're answering these questions, they directly mirror the questions that would be asked on the suicidal screen on pages 35 through 37 of your SOP. And just like the petition, it does have an opportunity to put you and your partner, along with any witnesses, listed in the notes. So summarizing, you have the behavioral worksheet, which is went from 1 into 2, both decisional and behavioral. And both of those will turn red instead of the one turning orange. The nice thing about, again, having them into separate forms is that you'll get these to turn red on cases where you would absolutely need or would be a necessity to have these worksheets filled out. Look for future CARS videos to highlight the use of the RAS score, or the Richmond Agitation Score, moving from a worksheet somewhere into the power tool area on the right side. Whether a standalone tool will be used or having it reside in the Vitals power tool will be determined at a later time. This is your Northwest Community Hospital CARS Committee. Stay safe, and thanks for watching.